Welcome to Pharmacy Prep, FPGE must know questions from social, behavioral, and administrative sciences. That is 22% of the exam syllabus. So let's start. Which type of healthcare delivery system is most common in the United States? A. Single payer, government run healthcare. B. Multi-payer, largely employer-based insurance. C. Universal national health insurance. And D. Free market with no government involvement. Pause the video and guess your best answers. The correct answer is multi-payer, largely employer-based insurance. The US healthcare relies on multiple payers like private insurers, Medicare, Medicaid, and employers. Next, all of the following countries have a universal healthcare system except A. Canada, B. United Kingdom, C. Germany, D. United States. Correct answer is United States. United States does not have universal healthcare system. Instead, it is mixed like private insurance, public programs such as Medicare, Medicaid, and also there are private insurances. Or there are some citizens that have no insurance. Whereas Canada, UK, Germany all provide universal healthcare coverage to their citizens. However, there are differences in the models of delivering healthcare. Which of the following US healthcare program primarily covers individuals age over 65 years and older? A. Medicare, B. Medicaid, C. Private insurance, and D. Affordable Health Care Act, also known as Obamacare. The correct answer is Medicare. Medicare, a federal program, covers 65 and older, and also there are some younger individuals, but disabilities or those with other conditions. So, Medicare has four parts. Part A covers for inpatient hospitals and also skilled nursing and hospice. Part B is for outpatient care, physician services, preventative care. And Part C covers Medicare Advantage, such as private plan alternate to original Medicare. Whereas the important for the exam also Part D that covers prescription drug coverage. Which US government agency is primarily responsible for population level disease control and prevention? A. Center for Medicare and Medicaid Services. B. Food and Drug Administration. C. Center for Disease Control and Prevention. And D. Agency for Healthcare Research and Quality. The correct answer is Center for Disease Control and Prevention is the lead federal agency for public health focusing on disease surveillance or disease outbreak control and also preventative programs such as immunizations and recommendation for types of vaccinations to the uh, US citizens traveling to other countries. So here, next, which of the following vaccine is a live attenuated vaccine? A. Inactivated polio vaccine. B. Measles, mumps, rubella, MMR. C. Hepatitis B vaccine. And D. Influenza inactivated vaccines. The correct answer is MMR or measles, mumps, rubella is live attenuated vaccine. So the live attenuated vaccines are contraindicated in pregnancies, and also immunocompromised patients. So here the mnemonic for memorizing live vaccines is I'll live in very big room. I for intranasal influenza and L for live varicella chickenpox, B for BCG, and R for rubella, and O for oral polio and oral typhoid. So here rubella is a part of those. So therefore MMR is comes under live vaccine. So MMR is the answer for the previous question. Next, Dr. John Smith is a physician with DEA number of AS1234563. And in this number, the second letter S indicates A, registrant type of physician, first letter of the prescriber last name, first letter of prescriber first name, and all DA numbers with A as the first letter. Correct answer is here in this number, letter S indicates first letter of prescriber last name. So this is an example of a DAA number. In these DEA numbers, this letter S here, in case of the example, Smith, the last name. So this is the first letter of the last name. Whereas letter A here indicate the type of registrant, like for example, A for physicians, prescribers. Whereas these 1 to 6 here are unique identifier digits, and then this last number is checksum digits. So there is an example here how to calculate those checksum digits as well. So we will see in other questions in the other mock exams in detail how to calculate those checksum numbers. Next, which of the following was a major provision of the Affordable Care Act, which is also known as Obamacare Act? A. Expansion of Medicare Part D coverage. B. Prohibition of insurance denial due to the pre existing conditions. C. Establishment of national single payer health care. D. Elimination of employer based health insurance. The correct answer is Affordable Care Act prohibit the insurance denial due to the pre-existing medical conditions. Here there are key features of this Affordable Care Act or pre-existing conditions and Medicaid expansion, health insurance marketplaces, individual mandates, essential health benefits, and also young adult coverage such as children can stay on their parents' insurance plan until the age of 26. Those are the updates of key features of Affordable Care Act, which has also named as Obamacare. Next, the covenant relationship between pharmacist and patient is best described as a legally binding contract that patient must sign, an unwritten agreement based on mutual trust and placing patient needs first, a federal regulation enforced by FDA, a financial agreement between pharmacists and insurance companies. The correct answer is covenant relationship is an unwritten agreement based on mutual trust and placing patient needs first. Those are considered as covenant relationship between pharmacist and patient, which is the ethical moral standards of healthcare professionals. Next, which DEA schedule is assigned to hydrocodone and acetaminophen? A. DEA Schedule 1, B. DEA Schedule 2, C. DEA Schedule 3, and D. DEA Schedule 4. The correct answer is DEA Schedule 2. Hydrocodone and acetaminophen combination comes under DEA Schedule 2, and there are other opiates as well comes under DEA Schedule 2. Whereas Schedule 1 or heroin and excrescence, which is not used in pharmacy or does not prescribed. Whereas Schedule 3 are combination of opiates such as acetaminophen plus codeine or anabolic steroids are part of Schedule 3. Whereas Schedule 4 benzodiazepines such as lorazepam and also non-benzodiazepine, one of them is Ambien or brand name Ambien, which is a generic name is Zolpidem. Next, Medicaid provides healthcare coverage primarily for A. All US citizens regardless of income. B. Low income individuals and families. C. Only adults over 65-year age. And our correct answer is low income individuals and families. Those are covered by the Medicaid, which is Medicaid is a joint federal and state program generally covered for low income populations such as children, pregnant women, disabled persons, and some adults, depending on state expansions. Whereas Medicare is funded at the federal levels and payroll taxes, premium, federal budget, while Medicaid is federal plus state sponsorship by share cost. Next, what is the primary function of pharmacy benefit managers, or also known as PBM? A, A, to dispense medication directly to patient. B, to negotiate drug prices and manage formularies on behalf of insurers. C, to regulate pharmaceutical advertising. D, to oversee FDA drug approval process. The correct answer is to negotiate drug prices and manage formularies on behalf of insurance. PBMs, which is a pharmacy benefit managers, act as an intermediate between insurance, pharmacies, and drug manufacturers to manage prescription drug benefits, which is also many medications require prior authorization according to the PBMs. Next, which of the following best describe the purpose of risk evaluation and mitigation strategy REMS program that is required by FDA? A, to ensure generic substitution is performed at the pharmacy level. B, to guarantee safe use of certain high risk medication by requiring additional safety measures. C, to provide financial assistance to patients who cannot afford medications. D, to replace FDA approval process for the new drugs. The correct answer is REMS, which is a risk evaluation and medication mitigation strategies, guarantees safe use of certain high risk medications, such as isotretinoin for acne or clozapine for schizophrenia. There are a long list of medication comes under risk evaluation and medication strategies that require special measures for dispensing those medications. So, the other programs such as PEM, post marketing evaluation surveillance, after drug approval in the phase 3, after phase 3, those post marketing surveillance called phase 4. Whereas MedWatch, FDA safety information adverse event reporting, that allows healthcare professionals or consumer to report adverse drug reactions caused by the drugs. Next, SEER program, which is a surveillance, epidemiology, and end results program for cancer registry, tracking incidents and outcomes. Next, what is the sales price, also known as retail price of a prescription drug, and the cost or average wholesale price is $19.50 and the markup of 8%. A dispensing fee is $9.50. A, $19.50, B, $30.56, and C, $9.50, D, $1.56. Correct answer is $30.56. Let's see how we get that. So the retail price formula, you have to memorize the formula for retail price, which is cost plus cost into percentage of markup and plus dispensing fees. So that gives you this $19.50 cost, and markup is 8%, which is in decimal 0.08, whereas dispensing fee is $9.50. So if you plug in this formula, before plug in, first calculate the markup for the cost, which is comes to be $1.56. So now if you plug in those numbers, it comes to be $30.56. That is the retail price for the given question. Next, which US federal law requires pharmacists to offer medication counseling for Medicaid prescription at the time of first dispensing and refills? A. Food, Drug, Cosmetic Act. B. Durham-Humphrey Amendment. C. Omnibus Budget Reconciliation Act. D. Prescription Drug Marketing Act. The correct answer is Omnibus Budget Reconciliation Act, also known as OBRA 90, which basically um, recommends medication counseling for Medicaid prescriptions at the time of first dispensing and also at the time of refills of these medications. Next, which federal law defined two specific medication categories as prescription and over the counter? A. Food and Drug Cosmetic Act. B. Durham Humphrey Amendment. C. Kiefer Harris Amendment. D. Omnibus Budget Reconciliation Act. The correct answer is Durham Humphrey Amendment. So, Durham Humphrey Amendment distinguished between prescription and over the counter drugs, whereas FDCA is FDA's authority to regulate safety and effectiveness of food, drug, cosmetic, and medical devices in the United States. C. Kiefer Harris Amendment required manufacturer to provide evidence of drug effectiveness before it is marketed. And the OBRA, which is required pharmacists to offer counseling to Medicaid patients regarding their prescription medication. Next question. If a clinical trial rejects the null hypothesis when it is actually true, this is known as type 1 error, also known as alpha error, type 2 error, also known as beta error, confirmation bias, and then regression error. Correct answer is type 1 error. So if a clinical trial rejects the null hypothesis when it is actually true, that is known as type 1 error. So let me explain this in detail by using this rubric. So here, according to this null hypothesis means H0. H0 is the null hypothesis. In reality, it is a null hypothesis. Means the reality is there is no difference, whereas researchers says there is a difference. So when reality there is no difference, but researchers says there is a difference, and now type 1 error happens when rejecting null hypothesis when it is true. So when there is no difference, but researcher says there is a difference. So that is an error, and that error is known as type 1 error. Next, which book contain therapeutic equivalence codes to determine if generic product can be substituted for brand name products? A. Purple Book. B. Orange Book. C. Red Book. And D. Green Book. Correct answer is Orange Book. So Orange Book provides therapeutic equivalence codes which indicates generic drug can be substituted for brand names. Like code A means the product are equivalent. Whereas Purple Book contain information on biologic products such as monoclonal antibodies. And B, Red Book focus on the drug pricing, whereas Green Book has list of FDA approved animal drugs. Next, a study reports an odds ratio 2.5 with 95% confidence interval between 1.2 to 3.8. What is the correct interpretation of this? A. No association between exposure and outcome. B. Strong positive association statistically significant. C. Strong association but not significant. D. Study lacks power. Correct answer is strong positive association statistically significant because odds ratio is greater than 1 and then which is more 2.5 and confidence interval is between 1.2 to 3.8. That is shows that positive association. And also it is a statistical significant because it did not cross 1 or 0. So therefore it is considered as odds ratio with the strong positive association, and this study is statistically significant according to the confidence interval. Next, which test is appropriate for comparing means of three or more groups? A. Chi-square test. B. Independent t-test. C. Analysis of variance, or also known as ANOVA test. And D. Regression. Correct answer is analysis of variance is compares the means of three or more groups. Here, analysis of variance compares means of three or more groups, whereas independent t-test or t-test compares means of two independent groups, whereas chi-square test generally used for categorical groups mean the one that has qualitative numbers, not the quantitative. So that is compare the proportion of frequencies between categories. Next, a test with high sensitivity but low specificity will most likely miss many true cases. B. Detect most true cases but include many false positives. C. Miss very few cases but exclude most false positives. D. Provide no clinical value. Correct answer is detect most true cases but include many false positives. Because sensitivity is ability to detect the disease, whereas specificity is ability to detect non-disease. So let's go over a little bit detail on this example. Let's say if there's a pregnancy test with high sensitivity and low specificity. Say sensitivity is 95%, specificity is 70%. So a pregnancy test, there are 100 pregnant women and there are 100 non-pregnant women. So in the 100 pregnant women, test shows 95 of them are pregnant because 95% sensitivity. That is also known as true positive. Whereas although there are 5 women are pregnant, but showing non-pregnant, which is a false negative. Whereas the specificity or non-pregnant, there are 100 non-pregnant women or not pregnant. Test shows 70 of them are non-pregnant. That is a true negative. However, it shows there are 30 pregnant, even though those 30 are not pregnant. Therefore, that is known as false positive. So, therefore, sensitivity is primarily used for best for screening tests. Therefore, you can't miss the any potential cases. Next, in 2005, 1,000 women worked in factory with exposure of carcinogenic chemicals. A study compared with the incidence of bone cancer in this woman up to 2010 with that of 1,000 women who worked in factory without exposure of carcinogenic chemicals. So results 20 of the carcinogenic exposure, 4 of them non-carcinogenic developed bone cancer. What is this study's example? A. Cohort study. B. Experimental study. D. Cross-sectional study. And D. Case control study. Correct answer is cohort study because this study is a prospective and followed for the next 5 years, starting from 2005 to 2010. So, therefore, prospective studies following up for 5 years and comparing exposure versus not exposure, which is also known as relative risk. That's what you calculate the cohort study outcome. Next, a case control study produced following results: 10 out of 100 exposed developed the disease, 2 out of 100 unexposed developed the disease. What is the odds ratio? A 2, B 5, C 7.5, and D 10. Correct answer is 5. So here, 10 out of 100 are exposed. Exposed divided by unexposed. So 2 out of 100. So if you divide them, it gives you the 5. That's it can be done by using 2 by 2 table, or faster way to do is divide exposed ratio divided by unexposed ratio. That gives you the odds ratio, which is here in this case 5. Next, a cost of lost productivity due to illness is classified as A. Direct medical cost, B. Direct non medical cost, C. Indirect cost, D. Intangible cost. Correct answer is indirect cost. So, lost productivity can consider as indirect cost. So, let's look at details. Direct cost include expenses directly related to medical care, like hospital, physician fees, medications, and lab tests. Whereas direct non-medical costs can be treatment-related expenses such as transportation, child care during appointments. Whereas indirect cost is productivity loss due to the illness or due to the disability, or unfortunately due to the premature death or missed work days or reducing earnings. Whereas intangible cost, which is also commonly tested in the exam, cost related to pain and suffering, anxieties, or decreased quality of life. Because pain and suffering, anxiety can be influence on the uh, quality of life and eventually can result into intangible cost, which is cannot be measured in the dollars. Next, in a clinical trials, intention to treat analysis means A. Only patient who completed the studies are analyzed. B. Only patient who adhered to the treatments are analyzed. All randomized patients are analyzed in the group they were originally assigned. And D. Patients are analyzed based on actual treatment received. Correct answer is intent to treat analysis means all randomized patients are analyzed in the group they were originally assigned. Next, what is the national drug code? 10-digit code used for identifying drug products, 5-digit code indicating the manufacturer of the drug, 3-digit code representing therapeutic class of drug, 7-digit code specifying the expiration date of the drug. Correct answer is a unique 10-digit code is used to identify drug products. So here, this 10-digit code is broken down into three sections. One is called labeler. Labeler indicates the manufacturer of the product, whereas middle four numbers, such as drug, which is specify the drug name, strength, and also dosage form, and the last two digits are amount in the package, such as 100 or 200, like those. Next, which DEA form is used for reporting destruction or returning damage or expired controlled substance? A. DEA 222, DEA Form 41, DEA Form 106, and DEA 224. Correct answer is 41. So DEA Form 41 is used for reporting destruction or return of damaged unwanted controlled substance, whereas DEA 222 for Schedule 1 and 2 drugs, ordering them, whereas DEA 106 is used for reporting theft or loss of controlled substance, whereas 224 is application for a new registrant under the Controlled Substance Act. All right, so with this information, thank you for joining Pharmacy Prep, and also stay tuned for more videos and subscribe Pharmacy Prep. Pharmacy Prep also offers self-learning courses for FPGE preparation. Those who are wish to interested to join those courses, please do join. Click on the pharmacyprep.com and then enroll now. Till then, thank you and see you soon.